This is a topic that really comes across a lot when you're working in cancer research, and also it crosses with the diabetes because for cancer, in the field of cancer, sugar is, extremely a potent marker of cancer diagnosis. Usually, you will see cancer survivors or cancer patients when before the cancer comes becomes full force, they would have fluctuating sugar, and diabetics usually have very prolonged process of wound healing. And when we have cancer patients where we're still in the conventional arena, who are doing chemo and radiation, their wounds do not even heal because the chemotherapy kills the immune system completely. It's more detailed than that, but it really kills the immune system and suppresses it. And if your immune system is dead, what made make any doctor think that you can heal the wounds? So the cancer patients often suffer with chronic wounds. And if the cancer was to go in remission and come back, guess what? Some cancer patients would have fungating wounds that start bleeding. They have chronic bleeding, so now they are losing blood and nutrients and iron that is required for oxygen breathing and walking and life. Losing nutrients through bleeding. It has odor, it has pain, and it is very chronic, and it does not go away for cancer patients who follow the conventional route. So they live with these wounds. So the work you're doing is extremely phenomenal. If you would like to share more about what you do and how you provide that to people.
So to take it back to the basics of a chronic wounded state, you mentioned inflammation being a big piece of your cancer patients, and I've actually kenned many times the demand on the body for wound healing as similar to the demand on the body for healing or fighting cancer. Um, we just spoke about the economic burden of disease and wounds, but inflammation being a big piece of chronic wounds, a wounded state. So basically, when the body is no longer healing, it needs to be retrained and reprogrammed into actually the mechanisms of which we were programmed to naturally return to a healthy state. And diabetics specifically have metabolic derangement, so they have senescent cells, they don't have the physiology of healing. And so reversing the chronic comorbidity state and getting them to a balance with their glycemic control is a big piece of what we do as wound care specialists. Another piece of it is chronic infection, not necessarily the kind of infections that we all think about that cause pus or pain um, or tissue loss. These are basically critically colonized wounds with bacteria and something called biofilm that enhances the metabolic demand and the utilization and dysregulation of oxygen and nutrients at the wound bed, such that the body cannot do what it's supposed to do, and that's stay in a whole state of healing and health. And then another third pillar here in this basic science of wound chronicity is obviously the chronic pain that's associated with these boring wounds, especially well, obviously if they still have some level of sensation. Diabetics tend to not feel their wounds very well, so we don't necessarily understand or see the toxic effects of chronic pain in the skin and the dermis and the tissues that the wound is existing in, but chronic pain being a significant issue with these patients. And so, as wound care specialists, we definitely take a full on holistic view of the patient and trying to control some of these more significant processes, such as inflammation, pain, and infection or sepsis. And our particular company and program do like to focus on those and engage modalities that will treat those things. So we obviously work with the primary care teams to metabolically optimize patients from a micronutrient level. We have dietitian nutritional referrals to do the management of the diet. We work with the diabetic care and the provider's diabetologist or a primary care geriatrician who's managing the diabetic regime and trying to get that under better control. But again, it's all a function of what you're eating. So we do take a very proactive approach in addressing the consumption of both macro and micronutrients for wounds. Um, we also deal with the chronic infection, the biofilm standpoint. And so the technologies that have come out that manage either mechanically or chemically the biofilm, and it's not just slapping on topical antibiotics because we all know that that's overused, and also the emollients and excipients of these ointments can be toxic to the skin in general and these cells that are actually trying to replicate and heal. But things that are actually saponifying or actually breaking down the biofilm, glycocalyx or matrix or extrapolymetric substances, or mechanistically removing it with debridement or um, hydrotherapy or even sound waves and cavitation, are things that are out there that we have at our disposal. In Denver at the Wish Clinic, we've deployed an ultrasonic vaporous hyperoxic therapy called Vaporox, which creates an ultrasonic water vapor that then enhance that alternates with the delivery of topical oxygen to address not only uh, the um, the oxygenation of the wound and the wound bed interface in terms of providing moisture for those cells to actually thrive, but also we believe has some mechanistic effect right onto the layer of the biofilm right on these wounds. And then, of course, we pair that with aggressive management of wounds, similar to a dentist taking um, a device to actually scale around your gum line to remove bacteria. We do the same thing with a curette or another other topical agents that we can actually mechanically remove biofilm, which exists both macroscopically but also microscopically inside in the depths of the initial depths of the wound bed. So removing that tissue serially over weeks is something that helps to control that. And again, remove the metabolic demand and energy sink that is created when it's overburdened with bacteria. And of course, these bacteria exist in colonies and they talk to each other and they're sort of fighting the body. And of course, in an immune compromised state, for example, in your patients or a diabetic patient or anybody on anti rheumatologic agents or have connective tissue disorders, they cannot fight that fight. And so the wound care specialist has to make the intervention. And we have these modalities to do that. Um, Obviously, the pain piece, there's folks here at this conference who deal with chronic pain and use things like laser therapy and other modalities and not just a pill to control chronic pain. Obviously, this is a mind body approach as well. And these modalities are things that we also deploy to address the chronic pain. Because if you're not able to touch the patient and clean these wounds, then of course now you deal with the overburden of infection and bacteria. And so much of that, I even tell patients very easily, if I can't touch you, then I can't help you. And so we do take a very proactive approach to help these patients with comfort. And mindful, obviously, to morphine equivalents, making sure we're not um, creating an abuse situation. But all their modalities are deployed to actually reduce pain. Now, obviously, if we can control infection, we can also help with the pain situation. Um, and I always say as a mantra, if you can heal it, you can heal it, because the nervous system actually does a lot to coordinate the healing of this tissue. And we're basically regenerating tissue, soft tissue over hard tissue or bone or tendon. And that's sometimes what we have to deal with versus trying to do what a plastic surgeon does and move tissue from one site to another site. We're actually encouraging the body to regenerate itself. And it is programmed to do that. We just have to turn on the right genes and understand what's causing the senescence and reverse that. Um, some really other really cool innovations, of course, is with regards to the kind of natural things that we have access to. One of them is placental membrane products. And of course, it's a raw material that used to be discarded in a red bag. And thanks to policy many about a decade ago with Obamacare, um, um, we were enabled to actually utilize this material to actually help with regenerative or regenerate for wounds. And so we deploy several different proprietary biologics and devices in our practice, and any wound care specialty clinic would have access to these modalities for patients. And luckily, several insure, this is something covered by insurance, and of course FDA approved. Um, and so we have human allografts that we get the stuff from, or this is supplied by. There's also xenografts involved, so animals do provide regenerative technologies through their soft tissues as well. Porcine or bovine or ovine products come to market that still provide structure and a matrix to help the body um, encourage it for healing and to regenerate that soft tissue as well. Is there anything else you would like to add?
Um, so from my perspective, like how you said, a couple of points really stand out. The first one would be like about the nervous system going into the fear and flight mode, because this is something we talk about a lot. It's just not about cancer. It's just, whether it's cancer or somebody has obesity, diabetes, just a lot of chronic pain and not able to heal their wounds. It's at the root level is extremely high level of inflammation. And in cancer patients it becomes worse because when they go for chemotherapy, this is a proven fact that chemotherapy kills their immune system, so it also actually doesn't help their inflammation heal. And when the inflammation is high, the body is already in a fear and flight mode, because the word cancer itself is full of fear. It's a highly political issue. It's highly controlled by the pharmaceutical companies. As we know, the corruption is beyond imagination in the cancer industry. So just to touch on that a little bit. So when somebody has cancer and they're told by their doctor you have this many months to live or this many years, the body is completely in fear and flight mode. It goes into the parasympathetic mode. And when your body is in a fear and flight mode, and you're going through the chemotherapy, you're going through the drugs, you're trying to think you're healing yourself. Guess what? The wounds are not going to heal, because to heal the wounds, you need to be in a sympathetic mode. So that's something that really stands out. Second thing is that in cancer, or even when we have chronic wounds like fungating wounds that don't heal, for example, um, from the perspective of Ayurveda or holistic medicine, or in India, for centuries and centuries, wounds are something that humankind has had since the day we were born. We came on this earth because whether we were hunter gatherers, we were cavemen, and we evolved to this society, we have always done something where we had small wounds to big wounds. Women had wounds through childbirth, for example, tearing and whatnot, and bleeding. So we have always had wounds. But back then, we didn't have hospitals and ICUs and doctors and their needles and drugs and whatnot. So how did we heal our wounds? And that makes me go back to my roots of India and Ayurveda. For centuries in India, we would just use turmeric. That is exactly what we did. We would use turmeric paste, apply it on a wound, and it healed. Another herb that really comes to my mind is licorice. It has been used and highly respected herb in Ayurveda. Licorice is one of the most profound herbs for wound healing. It creates skin regeneration, it heals the wounds, it stops the bleeding if there is, and it creates new healthy cells. Okay, so licorice has been used a lot, I think, even in traditional Chinese medicine, but I do know for sure in Ayurveda for centuries, whenever they were, really bad, small wounds to big wounds. The third herb that we have used a lot in India for wound healing is called Nerium indicum. It is, the Indian word would be Carvera. It has been used alongside turmeric as well as this one, licorice, to assist patients with healing wounds, be it like small wounds, big wounds. Carvera is one of the most respected herbs, especially for ulcers, wounds, bleeding wounds, and skin regeneration. So these are the herbs that were the main ones. The fourth star that you will hear a lot when you go to India, and you can see the trees of this beautiful herb everywhere in India, um, is neem, which is absolutely the miracle. Even I think personally, I think it's more than turmeric. Even it's absolutely a miracle when it comes to any skin issues. I have taken neem when I was a teenager when I had junk food. I had acne, and my grandma, when I went to India, visit my grandparents, my grandma freaked out. She said, "How come you have acne? You have such a beautiful skin." And I was like, oh my God, that's because of the American junk food I've been eating in college. So my grandma said, you need to start on taking neem. She started giving me, she told my uncle, go and get some leaves from outside. And that's the beauty of India. You don't have to go to doctor every single minute. We have trees everywhere of these medicinal plants. And we literally have tree right down our next door to our home. She said, my uncle, go get some leaves for neem tree, and I'm going to give her a neem bath. And she, boil the neem leaves, give me a bath with that water every single day. By the fourth day or so, my skin was back to pretty much normal. And then she put me on neem, eating neem. Neem is a bitter herb because it really cleanses your blood. So she put me on eating neem. So that's one of the herbs that is used extensively for all skin conditions, including wounds, and including wounds in those people like diabetics or who have really immunocompromised system. That would be the herb that we use. So, but licorice would be number one in Ayurveda. That's highly respected. And turmeric, Nerium indicum, which is Carvera, and then neem. And of course, you can always blend it with neem oil, which is also very available everywhere and applied on the wounds. It is also used in many holistic hospitals that still follow Ayurveda or Siddha medicine in India. They don't go to drugs. But if you were to have a wound in the hospital, guess what? You're going to have neem oil massaged on you. You might have turmeric and neem oil massaged on you, that paste. It also beautifies the skin. So it makes a lot of difference. Sometimes they will have it in aloe vera gel, because aloe vera gel is an excellent friend for any skin issue, just like neem is. So you can have licorice, aloe vera, or turmeric or neem all mixed together and massaging it on wounds. And this is really a powerful therapy. Don't underestimate it. It creates skin regeneration because in cancer patients who are going through chemotherapy, the whole point of chemo or drugs is to stop cell division, right? But if you stop cell division and you have wounds or bleeding ulcers, how is it going to heal? Whether you have internal wounds or external, it doesn't make a difference. Because once you stop this, when you're doing therapies, even if it's targeted, it's not that targeted. We haven't developed it to a point where it is exact. So whether it is targeted therapy or whether it is just something more general, but still directed as cell death, apoptosis, you cannot heal the wound. So what happens? And that's where I think a lot of holistic medicine has a place to come in, like your solutions or the Ayurvedic solutions that are absolutely safe. In fact, they will benefit anybody going through that immunocompromised state. Like cancer patients, and hey, you can apply this in the meantime. This has no side effect, no interaction with the drugs. In fact, turmeric would be helpful for your tumor, but are the doctors willing to use this in conventional arena? We haven't reached that stage. We still have to get it to that point where native remedies are available in hospitals all across the globe. And even if somebody wants to use the conventional treatment, they have access to these things because, I can't reiterate it enough, wounds are very chronic in cancer patients and in diabetic patients as well, but cancer patients especially. And in cancer patients, even more complicated because cell division is supposed to stop. So when you stop the cell division, you are in an inverse relationship with wound healing because wound healing cannot take place unless you have new cells coming out. So it's very that's the space where you come in, and where your product or your solutions can really make a big difference in the hospitals, especially for cancer hospitals.
So we can't underscore the fact that we're reversing the word. The word is senescence, so we're reversing non-replication for sure. Another wonderful botanical source of healing benefit actually comes from plants that actually create cannabinoids. So everybody knows of marijuana. That is one of the plants that develops but many things create cannabinoids. It's not just the marijuana plant. Hemp, of course, industrial hemp, which is legal. now in this country is a source of cannabinoids, as well as, get this, orange peels. But also, barnacles in the sea make, and many different types of animals can make cannabinoids as well. But cannabinoid chemistry is something that's been very fascinating to me in the last 3 years. I was introduced to it actually during an MBA deliverable, but we have decided to embark on a discovery of how these botanical medicines in in synergy or in entourage with these other herbs can actually create poultice and topicals and salves that can be applied directly to the wound beds in a safe and efficacious way. Obviously, the politics and the volatility of these markets here in the United States makes it very hard to promulgate this kind of medicine in practice, which of course is indigenous. And of course, we have this uphill battle of all the historic I guess, biases that have been introduced into Western medicine. But it is something of a passion of mine, and there are public domain testimonials more than we can count about patients that have decided to take matters into their own hands and to create a botanical application for their ailment. And many of them turn to things like you had just mentioned, and then add cannabinoids and terpenes, which are found in these plants, and they're simply anti-pesticides. So, anti-parasitic compounds and alkaloids and flavonoids, and there's all these supplements that are out there for other reasons that are currently FDA or FDA aware. I shouldn't say they're necessarily FDA approved, but the FDA is aware and is monitoring the supplemental market where some of these compounds are found commercially. And of course, under physician judgment in this country, you have practitioners, naturopaths, functional medicine physicians, allopaths too, who are open to these notions to actually putting these things together at the bedside and providing these therapies for their patients. And of course it's all the same chemistry, and I'll talk about the word biosimilar, but essentially we all have an endocannabinoid system in our bodies, and it's ubiquitous in all tissues, and it's highly concentrated in their skin, and it's basically paraneurologic system that many of us don't even know existed because it wasn't taught in allopathic programs. I've come to find it in the last 3 years, and of course, done a lot of study. And we're doing our own R&D, hopefully with the NIH, to actually truly study the endocannabinoid system in regards to skin pharmacology with wound healing. But there are definitely signal out there in many, 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 many decades of research regarding these compounds to actually benefit inflammation, pain, and infection, which were the three pillars that I talked about earlier. So important to getting the body to actually reverse the senescence and start healing and regenerating itself. And so I'd like to take the time to open up the floor to some questions. Please raise your hand and we'll be calling on you, sir.
Thank you. Um, I have some question for Dr. Campbell and Dr.
I'm
Gupta.
I'm a doctor.
You are not?
I worked in cancer research and I am a cancer survivor, and that's how I launched my business to teach people how to heal holistically
Okay.
from cancer and diseases that have inflammation, anything like that. So I teach about vegan food and lowering inflammation, healing from cancer because I healed myself through my journey. So that's what it is. I used to work as a biostatistician in cancer research in Methodist Research Institute and University of Texas Oncology, and that's how I have manuscripts on PubMed and NIH and stuff. But I'm not doctor.
Okay.
God.
Good.
No offense.
Okay. Dr. Campbell, do you speak French?
I do not.
Oh, you do not. Okay, it's okay. I will go because um, I would like to know. Um, you said which clinic is in Montreal?
Denver, Colorado.
Oh, Colorado. Okay. Um, how do you plan to attract more specialists in the field? And what is the pathway to do that? And for um, Mrs. Gupta? Samyata? Oh,
Somya.
it. They say Sanjay Gupta. No, it's okay. 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 I have one question regarding the dosage. You talk about turmeric and neem oil, because I live now in Canada in New Brunswick, but originally from Congo, and we have also I can say traditional medicine. And the big issue we have in that medicine is the dosage of plants and stuff like that. And that is my question for you. You talk about turmeric and licorice, yeah. I would like to know, how do you do to know that this person needs this dosage of herbs or things like that? Those are my questions.
Sure, I'll go first. How do we increase the workforce of wound care specialists in the country, but in this country, but possibly in the world? And I think attending conferences like this obviously is a big one to talk about what we do and generate an allure of how much of a gap there is, and of course all the wonderful things and that we actually have at our disposal to actually help patients in need of wanting to heal. Um, there's a strong chemistry, physiology, anatomy component to this. And so, my mission is to introduce the idea of wound care specialty in young youth programs, offer opportunities for STEAM and STEM kids to actually come and rotate through our clinic, um, encourage other programs out there that provide wound care services to do the same and be open to having observations. Obviously, approaching nursing and clinical medical programs to talk and continue to promulgate and be an advocate for the specialty. I call it a specialty like any other specialty out there. It's quite interesting that in this country, the American Board of Medical Specialty doesn't recognize wound care specialists as board certified providers. There isn't necessarily in the clinical scopes our physicians and podiatrists and physical therapists. In terms of the allied health folks, there isn't any one linear pathway to educate and develop a wound care clinician. There is in the nursing world. You can become a wound care certified ostomy and continence nurse, and then of course go on to be a practitioner of advanced practice in this country and perform wound care, get the same wound care certification that all of the other scopes can have. But again, there's no dedicated recognized taxonomy for wound care specialists. So we're ER doctors, we're internists, we're infectious disease. I'm a vascular trained general surgeon, emergency medicine, hyperbaric medicine, physical medicine and rehab, preventive health specialist. Anyone at this point can go and get a certification if you have and practice wound specialty if you have an unrestricted license to practice in all states of this country. Why we don't have this? It's very political. It's very competitive. But we fight for this as one of our primary missions to be recognized as a class of specialists and have a true specialty and recognition for board. Um, but again, it all starts at the grassroots level. We're all individuals in healthcare of service and want to be of best service to our customer or our patients. But I have it's an advocation, it's a dedication, it's a commitment, it's a specialty, it's a niche. And I think those who sustain in the specialty are those who are introduced to it in young in their training and come to love it and almost as anyone says it sort of picks them to do this. And at least in this country, obviously, where word and lore and indigenous um, history in other countries, becomes the healers are it's generational and it's passed down. But I don't see that sentiment being promulgated here in the north, at least in the United States where I spend most of my time. But I do think that the more we can promote it, talk about it, the more intrigue and interest it becomes, and folks will begin to want to become a specialist and start at a young age and then commit themselves to a career in it.
So I really love your question about doses. I get a lot of questions because most of my group is, people who have a lot of inflammation or cancer survivors who want to stay healthy, and then they come to my website and they say, "Oh, I love your recipes. I'm trying your tips and it's working." Or people who are actually just going through cancer right now. But like I mentioned in yesterday's panel, they are just tired of the conventional system. They're exhausted. It's not working, and then they come to me. So they will ask me like, okay, how much doses and whatnot. If I'm taking a herbal route, how many doses I take of this, and I always say that depends on a lot of factors. You would have to work. So there are two answers to this. If you're just using doses, as in say turmeric or whatever, or licorice, you have a wound, you just want to apply that, we can go back to something more of centuries back, where our grandparents, grandmothers, or great grandmothers, ancestors of the ancestors never had a system of weighing the herbs or the spices that heal us. They would just look at the site of the wound, take a little bit, mix it all, and apply it, and it's gone. So you would never see in any of the indigenous cultures or even in countries where holistic medicine has been practiced a lot, like India, Pakistan, Bangladesh, Sri Lanka, a lot of countries in Africa, Middle Eastern countries practice holistic medicine. The Greek and the Romans have practiced holistic medicine. Egyptians, of course. So you will not see, and of course, I want to mention Native Americans, shamans, or tribal, cultures, or indigenous. We were all practicing globally this holistic plant-based medicine because plants have healing properties, and these herbs have anti-inflammatory, antioxidant, or anti-cancer compounds, and we just knew it intuitively because we were so connected to nature. And when we were doing that, we would just make a paste, take some herb, make some paste, and you know what? The child is crying from this wound, apply this. You know what? The woman has this kind of wound from the childbearing, apply this. The men were working out in the cave or whatever, and they hurt themselves, apply this. So they just knew it intuitively. There was no weighing of that. You just weighed according, see, get the concoction made according to the size of the wound or the healing that's required. When it comes to taking it internally, now in the modern times, it's a little bit different because certain herbs or even certain antioxidants, like vitamin E, for example, or vitamin C, for example, need to be taken with consideration to the whole person. Because what does that mean? What condition is the person having that requires them to ask for this? Are they going to? Turmeric is just a spice. They can have it in recipes as much as they want. Okay, that our bodies know how to process the spices. That's not a big deal, and no one's going to take 1 pound of turmeric in a day. So we are pretty safe there, okay? Just a little bit of turmeric in a spice, in a curry, enjoy it. If you're a cancer survivor, cancer patient, you would take a little bit more, have some plant-based milk, have 1 teaspoon of turmeric in the morning, in the afternoon, in the evening. And that's exactly what I advise people, like it's called turmeric milk, golden milk, whatever you call it. So that's all safe. But when it gets to something like licorice, taking internally, or taking something like neem, it will depend on the condition. For example, if you're a cancer survivor, cancer patient, if your cancer is currently active, or you have severe inflammation, you're extremely obese, or you have diabetes, it will depend on that, because the dose that cancer patient would need would be something different, because neem is one of the best herbs that blocks cancer. It has been proven. And so if I'm a cancer patient right now, I have active cancer cells that are out of control. I would take higher doses of neem, turmeric, and many other anti-cancer herbs. If I am diabetic, I may have to consult an Ayurvedic practitioner, because it also would depend whether I have other conditions in the body. You cannot take a herb that might lower your blood sugar, for example. So it becomes different. But for cancer patients, that would work great, because cancer patients usually have elevated blood sugar levels. So it would depend on the condition that you're going through. Is it right now, or is it in the past, or are you just taking just for general health? What other herbs you're taking, and what other medicines you're taking. Because if you're taking other medicines, some herbs can interfere because these are medicinal herbs. These are not like culinary herbs that you're making use for pesto, for example. You can have some basil and mint pesto in your pasta. You don't have to worry about those. You can have it. But when it comes to medicinal herbs, some of them are really powerful, and that is why they work. But we have to take it in conjunction with what else you're taking. Are you taking some drugs? Are you doing both conventional as well as holistic route? Or are you just doing holistic route? And even if you're doing holistic route, what other conditions exist in your body? For example, if you just say, I have, very thin blood, or have often bleeding, your blood is very thin. You cannot take vitamin E, even though it is one of the most powerful antioxidants. Somebody holistic would be the greatest fool to say, hey, you know what, take vitamin E, and they will be ruining your health because vitamin E is a powerful, natural, healthy blood thinner option. So you have to think about what conditions you're having, why you're taking it. Is it just to maintain general health? Because in that case, if you say, "Hey, I really love being healthy and staying youthful and vibrant and looking great and whatnot. I want to take vitamin E." That's great, and I'll just tell you, you know what? The best way to take vitamin E is to have healthy fats, avocados, nuts, seeds. Have some healthy organic sunflower oil, organic coconut oil, and you'll get enough vitamin E. Organic hemp oil, so olive oil, you will get vitamin E. But if you are a cancer patient, because I have gone through that journey, when the doctor said, you need to take something blood thinner, you might have clots. After my surgery, they were like, you need to take something. I said, no, I'm not taking drugs. I knew better and I took vitamin E, and thanks to God, it worked, because I wanted to make sure I prevent my clots from coming. So it worked great for me. I took it by myself. I didn't ask any doctor. I can evaluate it myself because of my knowledge. So I took a high dose of vitamin E. It worked for me very well. So it would so just conditions, if when you're taking something internally, conditions, what condition do you have? And what is the state of your body? Is it inflammatory, or are you eating a vegan diet? Are you very healthy otherwise? And third thing is, are you just doing a holistic route, or are you doing both conventional or holistic? Because if you're doing some drugs, you will have to consult your practitioner. Like, it could be Ayurvedic doctor, it could be an integrative doctor who integrates both and can tell you, hey, you know what, you want to take this herb, that's great, but then we have to lower this drug, or we might not be able to give you this drug because it might interfere with this, blah blah blah. So it is just when you're taking internally, it's best to consult an integrative or holistic doctor, because that will depend.
I'll also add the fact that there's some amazing technology in the pharmacogenomics world that's actually coming out that actually will help to determine what the ideal body dose weight per patient, because it's very custom to the genome and the single nucleal polypeptides that affect our genomic phenoexpression. So and how we respond to these synthetics versus these botanical compounds in either isolation or in combination. So the more we allow for our biochemical scientists and engineers to create these panels for identifying SNPs and the genotype of, now that we have the human genome uh, mapped out, we'll be better suited as clinicians to translational scientists will be better suited to determine what the ideal dose is of these particular compounds.
To add one more point to really help you answer that question, because that's a really good question. I want to add one more aspect to it, because now we have evolved as a mankind, where we have hospital institutions, the weighing system and whatnot, and like you said. But there was a time for centuries and centuries, all of us on this earth, our ancestors did not have these systems, and they were not weighing anything per se. So how did they know how to take which herb? Because the drugs were not there at the time. So they were really dependent on, that's why they respected nature so much, because they had a very good relationship. They were dependent on these herbs to heal them if something were to take place. So how did they know? So the answer would be when we look back in time for centuries and centuries, all of these like shamans and indigenous healers, and if you go to the history of any country, be it any country in Africa or India or Pakistan, any of these countries, all of them will have a common theme where in groups of villages or communities, there would be a head person who knows more about herbs. And when a child or somebody is sick, they would go to this person, and that asks about, which one we take, what plant do we take, and they would make a concoction and say, hey, you take this. So they would have this person would have a very good, like a shaman or healer, would have a very good relationship with the herbs, and they have observed over the years what are the effects of this herb and that herb, and which one works for what, and they would prescribe it. So it was like having a doctor in a village, but not really a doctor that gives drugs, but more like giving herbs. So they would know the right dosages. But that's something we have evolved from. So just wanted to answer that back when you go back in time.
Thank you. Why I ask this question is because we are trying to make healthcare more integrated, right? Instead of uh, going like silo. And if you want like traditional or Eastern or Western medicine to work together, you should have like measurements to compare. And I like the answer about the pharmacogenomics and all. That is the way to go because if you base your research on, I can say empiric, that what you say is,
Turmeric.
yeah,
Yeah, yeah.
empiric approach, it will be difficult to
Standardize it, to
yeah,
homogenize the practice for
exactly.
sure.
That's the point because in Congo, we had uh, one professor was working on kidney insufficiency. My English is not that good because I speak more French than
Sure.
English. Yeah. And they found that some kids were doing like insuffisance renale, chronique interminable. That I don't know.
They were taking higher doses than they needed to be taking.
No, it's like what she said. You just see and give herbs to eat, for example. It might be dangerous for kidneys.
Sure.
And yeah, they discover some things that that's why we need to be careful.
Yes.
Yeah.
And that's why I said, like, uh, there was to be no answer for dosage. The person needing the herb, wanting the herb, needs to go to the integrative practitioner and ask them, hey, I want to take this herb, or I have this condition. What is the right dosage for me? So that way your doctor knows all of your condition and your weight and what else is going on in your body, and if you're taking other drugs, and if the herbs might interfere with the drugs, and they can advise the right dose. Also, one more thing you can look at since you're developing a system is research papers, because, for example, now we have this boom in herbal demand, right? So, for example, I can say in America, we have these standardized doses of turmeric along with black pepper and other herbs being sold for different conditions. But also, there's research that's backing it up that, okay, this much dose was given to these number of patients, and this is what worked. So, that's the part of the doctor to know, and when the patient needs it, they will again evaluate what drugs you're on, which one might interfere. Like, I gave an example of vitamin E, for example. Licorice cannot be taken just because you want to take it. It has to be according to the conditions and whatnot, unless you're a doctor or you have profound knowledge. Like I took vitamin E on my own, but it's my body, so I just took it. So I was aware of it, but yeah, you will have to just consult a integrative practitioner or Ayurvedic doctor and work with all of the team, like a community. Yeah. Any other question? I think we're done.
Wonderful. Thank you for attending and staying with us this afternoon. If anyone would like to contact me specifically, you can do so at Dr. Tracy K That's DRTRACIK at thewishclinic.com. I also provide expert consulting and advice with regards to anything wound related or cannabinoid pharmacology with regards to skin repair and wound healing. Thank you.
And to reach me, you can definitely find me on thegardenrecipe.com. And that is where I teach about vegan plant based recipes, harnessing the power of spices done with Ayurvedic style. It also features a newsletter which goes out focusing on spirituality, sexual trauma, healing our sexual trauma, sex and intimacy, sexual, mental, emotional, because we are a whole body. Until we heal our trauma, we cannot heal ourselves at a root level. So I write about all this on my website, thegardenrecipe.com, as well as health articles focusing on herbs and remedies and proven systems from all over the world. So you can check it out on thegardenrecipe.com. And if you need to reach me, please feel free to contact me from there. Thank you.
Great. Fantastic job, ladies. That is a wrap, my friends. Day 3 of Health 2.0 conference. Round of applause. I do have a couple of updates for you. So thanks for staying in your seat before I let you go. We do want to give a huge heartfelt thank you to our platinum sponsor, Flow Patterns, and bronze sponsors, Anise Health and Fitness, and to you guys. You're amazing, each and every one of you, sharing your story, participating, being here, putting in the time. So your enthusiasm and participation has just made this event a huge success, and we're so looking forward to seeing you at the next event. Speaking of which, I'm so excited to share with you, we've got the agenda up for the next event in Dubai this December, as well as next year back here in Vegas, 2025. In fact, if you'd like to take a peek at it, you sure can. Just head over to www.health2conf.com, and you'll have more details on all the great things coming up at our next events. Guys, it has been a pleasure being here with you, and I'm seeing these last few days. You are all such an inspiration. Thank you for spending the time again, and keep on doing what you do. Keep on helping the world one person at a time. I should say for you guys what it's like 500 at a time, and keep helping each other. So have a wonderful